Question number 32. AP and lateral wrist radiograph of the mid forearm reveal a fracture of the middle third of the radius. Which anterior radiograph should be performed? Wrist. Okay. Question number 33. Which of the following the most common type of Salter-Harris fracture, accounting for over 70% of both plate fractures of the immature skeleton? Type 2. ठीक है. Most common type of Salter-Harris fracture is type 2. Question number 34. Patient has painful scoliosis. Improves is described as parent. MRI shows localized area of inflammatory change in the left pedicel of L1. CT scan shows marked sclerosis in the same region with a 5 mm cortically based central lucency, most likely cause osteoidosteoma. So see, this is also osteoma. This is in the bone. Marked sclerosis in the same region with central based lucency, central nidus, surrounded by marked sclerosis, diagnosed osteoidosteoma. The frontal bone ivory osteoma. Next. Number 35. MRI of the cervical spine. Small area of edema identified within the cord, most likely diagnosed sternal cord syndrome. MRI of the cervical spine has small area of edema identified within the cord, most likely diagnosed sternal cord syndrome. Question number 36. Vertebral sclerosis confined to the upper and lower end plate with preservation of the intervertebral disc. Regulatory spine is seen most commonly with which underlying condition? Renal osteodystrophy. Now this is hyperparathyroidism, regulatory spine. This is vertebral sclerosis confined to the upper and lower end plates with preservation of the intervertebral disc space. Most commonly seen in renal osteodystrophy, hyperparathyroidism. Question 37. History of mild foot pain. The shape of motor neuroma. History of mild foot pain exacerbated by walking wearing tight shoes or someone whose hyperquick 7 mm rounded lesion lying in the third tarsus space. MI intermediate on T1 and low on T2 without following condition best explains motor neuroma. MI intermediate on T1 and low on T2 and or someone's hyperquick lesion in the third tarsus space, motor neuroma. Question 38. Painful left mandible. Radiograph shows a simple linear fracture through the left body in the symphysial region. A second fracture is most likely to see in which of the following sites, contralateral condyle neck. Painful left mandible. On a radiograph, there is simple linear fracture through the left body in the symphysial region. The second fracture is most likely to be seen in which of the following, contralateral condyle neck. Because when a fracture is seen on one side of the one condyle of mandible, then there will also be a fracture. Mandible fractures are at least two sides. So, if the simple linear fracture to the body of the parasympathetic region seen, then there must be a second fracture at contralateral condyle neck. Question number 39. The following most specific indicator of possessive loosening following total hip replacement. CMM loosening line at the cement possessive interface. Most specific indicator of possessive loosening following total hip replacement. CMM loosening line at the cement possessive interface. Question number 40. Pain has history of Ewing sarcoma. He is treated with limb sparing surgery and chemotherapy. Well-defined renal sclerosis. Isotope scan shows corresponding portopenic area, most likely cause of his pain, radiated necrosis. And these are all radiated necrosis. Okay, this is radiated colitis. Thickened bowel loops. Forget these now. This is procedural membranous colitis, neutropenic colitis. These we'll see afterwards. But this radiated colitis, thickened bowel loops. These again radiated enteritis. Increased folding and thin narrowing bowel loops. There is radiation-induced mediastinal fibrosis. There is radiation-induced osteonecrosis. You can see this part of the mandible is broken and the bones is irregular compared to this side. Radiation-induced osteonecrosis. So, history of Ewing sarcoma, treated with limb sparing surgery and chemoradiotherapy, well-defined renal sclerosis, Isotope bone scans with corresponding portopenic area, most likely to cause radiated necrosis. Then 41. An MRI performed for tendon osteosarcoma of the femur metaphysis in an adult. Which feature most frequent determines the presence of migrant chain, thickness of the cartilaginous cap. In osteochondroma of the femur metaphysis in adult, which feature most likely determine presence of malignant chain, thickness of cartilage cap greater than 2.5 cm determines malignancy. Question 42. Which single addition finding favors a diagnosis of post-operative fibrosis or recurrent disc perfusion, enhancement of intravenous gadolinium, post-op fibrosis enhances. Which single addition feature uh, favors a diagnosis of post-operative fibrosis or recurrent disc perfusion, enhancement of intravenous gadolinium because post-operative fibrosis enhances. Question 44. For an RTA with thoracic bone fracture indicates significant damage to intrathoracic viscera, first rib. For an RTA with thoracic bone fracture indicates significant damage to intrathoracic viscera, first rib. Question 45. Left temporal parietal swelling and underlying fracture on skull radiograph. GCS initially normal but begins to deteriorate progressively. Which finding other than skull fracture would you expect to find on CT to explain the patient's condition? Extradural hematoma. GCS initially normal but begins to deteriorate progressively, and left temporal parietal swelling. So, which finding other than skull fracture would you expect to find on CT to explain the patient's condition? Extradural hematoma. Question 46. Hyperflexion of the proximal interphalangeal joint, index finger with hyperextension of the distal interphalangeal joint of the same finger, described Botanian deformity. Hyperflexion of the proximal interphalangeal joint, hyperflexion with hyperextension of the distal interphalangeal joint, diagnosis, Botanian deformity. Question 47. The catarrhal head at risk signs are plain radiographic signs that indicate a poor prognosis and increased risk of femoral head collapse in left card prosthesis. These are found often ignored such a sign metaphysicial bone resorption. Cathedral risk signs are lateral subluxation, speckle calcification, diffuse metaphyseal rejection, horizontal slices, and the Gage sign, but there is no metaphyseal bone resorption seen in cathedral risk sign. In cathedral risk sign does not include metaphyseal bone resorption. Question 48. Which of the following additional views should be performed? Knee. 48. A young male patient sustains external rotation injury to his left ankle, unable to bear weight. Radiograph of the ankle performed external emergency shows no fracture but does not show soft tissue swelling. It does show soft tissue swelling and over medial malleolus. Which of the following additional views will be performed? Knee joint. Question 48. Tarsal coalition is common cause of foot pain. Which of the following joint most commonly affected? Calcaneum navicular. Calcaneum and navicular bone are both fused, so it's called coalition. Fusion of the calcaneum navicular. Calcaneum navicular coalition. So, tarsal coalition, joint most commonly affected is calcaneum navicular. And tarsal coalition most commonly affected joint is calcaneum navicular. Question 50. Otongi unhappy triad consists of injuries to which three internal structures of the knee that are commonly injured together: anterior cruciate ligament, medial collateral ligament, and medial meniscus. Otongi unhappy triad consists of anterior cruciate ligament, medial collateral ligament, and medial meniscus injury. Question 51. With the following skeletal location does avascular osteonecrosis typically only occur in the presence of associated fracture, proximal scaphoid pole? Which of the following skeletal locations does avascular necrosis typically occur only in the presence of associated fracture, proximal scaphoid pole? Question 52. Which type of stable fracture is most commonly associated with significant neurologic injury, posterior rim or wall? Which type of stable fracture is most commonly associated with significant neurologic injury, posterior rim or wall? Question 53. Which of the following subtypes of osteosarcoma is associated with the most favorable 5-year survival, parosteal? In osteosarcoma, most favorable 5-year survival is seen in parosteal osteosarcoma. In osteosarcoma, most favorable 5-year survival is seen in parosteal osteosarcoma. Question 54. Radiograph of the hand for a palpable painful hard lump on the dorsum. Radiograph shows well-defined bony mass. Okay. The bizarre parosteal osteochondromatous proliferation. If you want, you can read this by yourself. You can pause the screen and read it, but you can go through it. Radiograph of the hand shows a palpable, painful, hard lump on the dorsum. Radiograph shows well-defined bony mass applied closely to the diaphyse of the second metacarpal. It is a white base with ungraded legend with a perpendicular or anterior diaphyse and mixture of mature tartulated bone, most likely diagnosis, bizarre parastitial osteochondromatous proliferation. Question number 55. Anterior shoulder dislocation, following uncomplicated reduction, unable to abduct the arm, and complaints of numbness over the upper lateral arm, most likely cause axillary nerve palsy. Anterior shoulder dislocation, unable to abduct the arm, and numbness over the upper lateral arm, diagnosis axillary nerve palsy. Question 56. Bilateral hand radiograph for painful and stiff joints. Symmetrical parastitial reaction involving the metacarpal, increased soft tissue of the fingertips, and increase in the longitudinal curvature of the fingernails. Radiation imaging investigation is most appropriate. Radiograph of the chest. Bilateral hand radiograph for painful and stiff joints. Symmetrical parastitial reaction involving the metacarpal, increased soft tissue of the fingers, tips, and increase in the longitudinal curvature of the fingernails. Which radiation investigation is most appropriate? And radiograph of the chest. 20%. Which is the fracture dislocation? Barton fracture. Let's see here. Let's forget the rest. This Bennett fracture, Boxer fracture, okay, Cordis fracture. Now this is Cordis fracture, then Smith fracture and Barton fracture. Smith fracture, Barton fracture. So remember that with the fracture dislocation, Barton fracture is dorsal radius fracture with dorsal dislocation, radial joint. Dorsal radius fracture with dorsal dislocation. This radius is going dorsally, so it is Barton fracture is fracture dislocation. Dorsal distal radius fracture with dorsal dislocation, radial carpal joint, Barton fracture. 58. Which adrenal feature is more likely to support diagnosis of rheumatoid arthritis rather than osteoarthritis? Protrudio, trozio, or acetabular. Which feature is more likely to support diagnosis of rheumatoid arthritis rather than osteoarthritis? Protrusio acetabular. Question 59. This soft myxoma, high on T2 and low on T1. Low on T1 soft myxoma is high on T2. Soft myxoma high on T2. So my smooth, well-defined location doesn't locate in the abdominal quadrant muscle, which returns low signal on T1